Hospitals, emergency medical technicians, and other first responders across the country are upgrading their protective gear for the possibility of dealing with Ebola patients.
In fact, a Fisher's company that provides protective gear is seeing a huge spike in orders as we speak. As Eyewitness News reporter Rich Van Wyk tells us tonight, even local emergency responders are waiting on their orders as well. Rich.
As a matter of fact, Indianapolis EMS is waiting on 58 cases of new, more effective protective coveralls for its workers. There's been a nationwide increase in the demand for protective gear. As a result, in some places, there have been some pretty big price hikes announced. New coveralls will provide emergency medical workers even more protection than existing ones. Open seams like these in the fabric are sealed shut, moisture-proof, reducing the possibility of first responders being infected with a patient's bodily fluids.
If we can enhance or make our providers that much safer, then we owe it to them to do so.
But they're pricey, more than twice as much as standard coveralls.
We're going from a $5 suit to a $12 suit. It's worth every penny of it, I think, if it keeps our providers safe.
Manufacturers of protective clothing and devices have been overwhelmed with orders since the Ebola virus arrived in the U.S.
This is quite a surge of interest. It ratchets up the panic a little bit and the fear.
Tony Baumgartner says orders are up 1,000% from a few weeks ago. The Fisher's company specializes in hazardous chemical and infectious control products.
This is probably 80% of our sales right now is this particular product and other similar suit kits.
Kits designed to protect healthcare workers from head to toe. A protective gown and hood, mask, rubber gloves, and safety glasses. Rolled up, bagged up, boxed up, shipped out across the U.S. and to several countries.
Easy to dispense, easy to grab and go.
There is now a 4-week back order on these protective kits. For the first time, the company is limiting sales to healthcare workers and emergency service providers.
We want to make sure that that supply chain stays somewhat protected for the folks who are really on the front line of healthcare response.
That Fisher's company, DQE, says its prices have remained steady, but price increases were announced months ago by its suppliers. Those price increases are going to take effect in the new year. As far as Indianapolis EMS, it's been warned by suppliers to expect a 400% increase in some of the products that it may need as it confronts this crisis. Reporting live, Rich Van Wyk, Channel 13, Eyewitness News.